Not all hot flashes is due to the menopause or the perimenopause. And although the perimenopause is the commonest reason for these hot flashes, one must keep an open mind as to what the other potential causes are, just to not miss something. So common causes are alcohol. Alcohol can also trigger the hot flashes that we see in the menopause and the perimenopause, as can emotional distress. So that's probably one of the commonest causes. Over-the-counter medication is the second common cause. So niacin or vitamin B3 is often taken to lower cholesterol. So if this is used in very high doses, it's most likely the culprit in terms of the hot flashes, or contributing to perimenopausal hot flashes in women, worsening it. So this is also often the rate limiting step if we treat high or certain cholesterol problems with an niacin, is that people experience such severe hot flashes that they cannot continue with the treatment. Other medication that can cause it are things like carbidopa or levodopa or bromocriptine. So these are dopamine agonists, and these are drugs that we often use in the management of Parkinson's disease, not pancreatitis. That's what you get from too much alcohol. And things like restless leg syndrome, and to stop lactation in women that do not desire to have lactation, or when you treat conditions such as prolactinomas. Other endocrine conditions, again, it's very rare, but just consider carcinoid syndrome, especially if the temporal relationship with regards to these flashes is associated with food intake, and if there's bowel movements or diarrhea associated with this. Pheochromocytoma is often thought of, but it's very seldom the causes of hot flashes. There's usually other signs and symptoms. And depending on the hormone that's secreted, these people can in fact actually have the opposite. They might actually feel sweaty, but when they look in the mirror, they might, contrary to hot flashes, experience more pale skin, or people that see them will just mention to you that despite these symptoms, the patient's skin was not red. It's not, as in medicine, nothing is absolute, but that might just be a clue in terms of your differential diagnosis. Other more serious conditions is hematological conditions. So what comes to mind is systemic mastocytosis. So that is a condition where histamine and prostaglandin is secreted, and these patients often present with skin lesions, and if you rub or scratch the skin lesion, there's usually a reaction, and they usually have an intense desire to scratch due to an itchiness or pruritus. Certain basophilic leukemias can lead to that, but again, these hematological causes and the endocrine causes are by far in the minority. Exclude medication. If it's in the right time frame for menopause, it's most likely menopause, and if not, just keep an open mind for the other conditions, because remember, the blood tests, the FSH and the estradiol that we check, might actually still be normal 6 months before the last menstrual period.